Good afternoon, good evening. I am Dr. Eric Shiraev. We study psychology together. We continue to talk about mental illness as we did in a previous lecture. And uh, Also in the future, we will discuss mental illness from different aspects. And today we will talk about anxiety disorders. Thank you to the dudes for helping us record this lecture. It is difficult, of course, using only 30-minute span to discuss all anxiety disorders, but it's a very important subject. So many people around us have problems with their anxiety. So many people need help. So many people need attention to the issues. My goal today is to describe these disorders, describe several kinds of them, major symptoms, a little bit about causes, and a little bit about treatment, or at least how we approach these problems. Of course, you after this lecture, you can check your knowledge, and as always, as it's with every lecture, you'll find several practice questions and answers as well. You can practice your knowledge. Well, as always, I'll share the screen with you, and by sharing the screen, I will show you the PowerPoint slides, which have been designed. There we go. This is again they are, and so I'll enlarge it. And here we go. Anxiety disorders is our subject today. Well, we will briefly look at generalized anxiety disorder, then we'll describe panic disorder, then phobias, and then at the end, obsessive-compulsive disorder. There are more than 4 types of them, and there are many subtypes and kinds, but I decided to focus on only 4 of them. Well, overall, anxiety is well, a very complex type of human experience. It's about worry, about apprehensive anticipation of something. Anxiety is not a simple emotion, it's a combination of different emotions. Anxiety is very, very diverse and very dissimilar in us, because anxiety is about anticipation of something which we don't know what it is, and or we know, but it's not specific as fear. I'll tell you, the difference between anxiety and fear is, in general terms, that fear is usually specific. So I'm afraid of dogs. I'm not, but for example, or I'm afraid of high places, or I'm afraid of this situation. So it's I think I'm not safe, right? Anxiety is free floating. It's about anticipation, worry, waking up in the morning and feeling tense, feeling anxious, as we say. Uh, and that's the difference. Of course, fears, anxiety overlap. Let's discuss generalized anxiety disorder. First of all, to understand any anxiety disorder and generalized anxiety disorder in particular, we must understand that anxiety is normal type of experience. By normal, I mean we experience it every day, sometimes more, sometimes less. This, for instance, is how we experience anxiety every day. A little bit anxious, not we in normal average state of mind, unnoticeable. Uh, but generalized anxiety disorder is elevated anxiety. So it's something that's bigger, something larger, something more substantial, something more influential. Influential. Remember lecture on mental illness, abnormality, distress, and dysfunction. So you apply these 3 principles to a state of anxiety to say, oh, that's a normal anxiety. We need to worry sometimes, or this is abnormal. Abnormal. The definition of generalized anxiety disorder, or GAD, is this is disorder which is characterized by excessive, uncontrollable, and often irrational worry about everyday things, and this worry is disproportionate to actual source of worry. So, in other words, too much of anxiety, it's too powerful, and it looks like it's not supposed to be that powerful, and yet it's still there, still there. Usually symptoms must last for a significant period, not just 1-2 days, and we must understand it. So usually it's supposed to be a few months, 6 months, but not a couple of days or a couple of weeks, for example, because those types of anxiety we experience quite often. Preparing for exams, tests, You apply for school, and then for 2 weeks you're a little bit apprehensive and anxious. It's normal anxiety. This is something which we all, most of us, experience. 6 months is the duration of symptoms. And what kind of symptoms we recognize? Here, I say that not all of them should be present. As a rule, I would say 3/4 of symptoms, just give or take, but I'll give you ballpark. 3/4 supposed to be present. What kind of symptoms? Well, feeling tense or restless. Not 5 minutes a day, but most of the day. Most of the day, feeling tense, restless. Irritability. So things bother you, annoy you, noise outside, well, voice of your professor, then the music from neighbor's window, the weather outside. So, and you notice that you irritate so easy, easy becoming tired. So you begin project, you're tired, you start watching film, well, just you well tired watching film on Netflix or on cable. Difficult to pay attention, yes. You can focus, you can concentrate. Work, even simple conversation. It's you notice that your mind is elsewhere, like floating away from you. Sleep problems, usually sleep disturbances, insomnia. So we studied insomnia in one of the lectures, and it's a difficulty to sustain or maintain sleep, and also pains, tensions, and muscle pain. Typical for anxiety, typical for emotional, chronic emotional problems. It's associated with tension in the body, and with many other reasons. So that's the way the brain works. So we feel the pain, and yet there's no physical damage to a tissue or bones, but this is how anxiety correlate, comorbid with feeling such as pain. So this is how tense the situation can be. And also, I put it right here, that worry is experienced as very challenging to control. It's not just, okay, I shouldn't worry, I should not worry, and I'll be just fine. It's not that easy. It's not that easy. Well, the worry involves many things, and many things become threatening. People who have anxiety problem tend to seek help from others, asking questions, which we sometimes find, why asking this question? Yeah, we know that the test is tomorrow. Why asking again about the test? So we need this reassuring answers from individuals. It's about worries about job, it's about health, about financial matters. In children, it's in particular worry slightly different compared to adults, because children pay excessive attention in this case to the looks, their performance, relationships, which we adults often find, well, too shallow. It's not important. So, well, don't be afraid. People tease you at school or whatever it is. It's a nice jacket. Wear it. No, it's okay. So, but to them, many things that's we find unimportant become important and become substantial. Um, Usually it runs in families. So there's a genetic factor in anxiety disorders. Median age of onset 30 means that half of people diagnosed early and half diagnosed later. Prevalence about 3% in adults, 10% in adolescents. It's more elevated during late teens, and typically occurs in response to a life stressor, something that is happening in life. Not necessarily huge and horrible, major, but it could be, well, once again, long examination session. It's a life stressor. Family member lost a job, or you lost a job in the process of applying. That's a major stressor. Migration, immigration, it's a life stressor. So this is typical onset where it is. Before I move further, I should say that generalized anxiety disorder is very common in us, and so many people have this and not diagnosed because they simply don't want to share this with others. Consider this just stress. Some of them see it as a sign of weakness. They want to appear weak. Others don't even consider this a medical problem. saying that this is not for medical professionals to resolve. It's only my issue, which is not true. Which is not true. There are different forms of treatments, and so definitely professionals competence to give best advice with the use or without the use of medications. Please understand that anxiety disorders can be treated without medication. Well, can be treated with medication, but can be without, with the use of psychotherapy, which is not combined. Can be used separately from medication or independently for use of medication. Second kind is a panic disorder. It's a more less common, but it's the consequences of panic disorder and the course of the experiences quite devastating in individuals who have it. Panic disorder is a series of repetitive and unexpected panic attacks. So in other words, panic disorder is diagnosed in people who go through panic attacks, and well, must be chain of them. Not necessarily every second, but they're repetitive, maybe every day, maybe every week occurrences, maybe twice a week. But there are discrete periods of intense fear and discomfort in which several symptoms develop abruptly and reach a peak within approximately 10 minutes, give or take. What is a typical panic attack? I'll give you symptoms, and you say that what you feel right away when they describe the symptoms. Heart palpitation, sweating, trembling or shaking, shortness of breath, choking feelings, chain pain and discomfort in chest area, nausea, abdominal distress, chills or hot flashes, numbness and tingling sensations in extremities. If you look at this list, what is your first immediate reaction? What you don't know that the panic attack, but you look at the symptoms: sweating, shortness of breath, chest pain. Well, it's a heart attack, right? It's almost immediately. And if it's heart attack, we need to get help immediately because every second matters. But it is not. It is not. See how confusing and how strange the symptoms can be for individuals. You know that probably you has been in this situation many times before. A person may think, but how do you know that this time it's not a heart attack? Very unpleasant, scary, really devastating type of experience individuals go through. Add to the psychological phenomena such as psychological processes or fear of dying, derealization, feeling of uncertainty, emptiness, depersonalization, so a feeling of being detached from self, dizziness, unsteadiness, lightheaded. You feel that you're lightheaded. So it's a very, very unpleasant condition. People who have this problem also develop, as we call it, anticipatory anxiety, so anxiety of anticipation. I know that this was happening to me in the past. I know it will happen to me, and that creates extra anxiety. You know situations that you remember your fears, you remember unpleasant developments, and there you go. You face those unpleasant developments again. You remember your fear. Panic disorder, panic attack, usually triggered by situations. That's being in the car, being in public transportation, boarding a train, boarding a plane, being in a high place, crossing the bridge, being in open space, being in closed space. That triggers, that's launch this unpleasant, serious reaction. Unfortunately, in attempts to cope with the problem, many people turn to self-medication, and self-medication often involves alcohol or other psychoactive drugs. They may bring some temporary relief, but overall they make things worse. Unfortunately, this is very common practice of individuals. They don't want to bother doctors with this. They want to tell family members about this, hide these symptoms, try to cope themselves, thinking, well, it'll go away and I'll be fine. But it's not that easy. So panic disorder is treatable, and there are your prime care physicians who are qualified to give initial advice or refer you to a healthcare professional who will definitely take care of you. Don't let anyone just walk with this problem believing that it will go away. It is treatable. Phobia, as I told you, phobia is different. from anxiety, because phobia is an irrational, intense, persistent fear. So fear is specific, and anxiety is more general. It's more general, free-floating, as we say. Phobia is not just a fear, it's irrational, intense, persistent fear of certain situations, activities, things, animals, or people. The main symptom here, the excessive and unreasonable desire to avoid the feared stimulus. So, for instance, give a difference using my own. If I, for the sake of example, if I am afraid of spiders, is it a normal fear of spiders? Yes, it is. Is it normal, for example, to go outside and check your shoes and especially if they're in the garage, and see if there's spiders there, because you know spiders are in the garage or in the basement. Yes, just people do this stuff. You look for spiders well when you're in the woods. You see, and not actually look for them, but you see if they are around you, especially. It's so there's a web around you. It's normal. But when you, and if I check my bed before going to sleep for spiders, however, I've never seen them there, but still I think, what if they're there? If I wake up in the middle of the night just looking for spiders on my pillow, if I feel that spiders are crawling all over me, and I go and check myself in the mirror all the time, so this is something becomes a bit overwhelming. You have nightmares about it. If you can watch videos with spiders, so avoid, at the same time check everything in my house or apartment. That's the beginning of excessive fear, which may qualify as phobia. Remember, it must be abnormal, must be something that's really disturbing and distressful, and also it affects effectiveness of your life significantly. Several kinds are distinguished. The animal type, it's very common. That's excessive anxiety, fear, and avoidance of certain animals, and there's so many of types of animal type of phobia. Very common, of course, dogs. Early 20th century in North America and Europe, as far as we know, the fear of horses was common because there's so many horses before automobiles that took over our streets. It's a culture specific. Most people in North America don't have fear of camel, for example, phobia related to camels, but it's more common in other parts of the world, and so forth. Children are more prone than adults, and in most cases, I always tell parents that if a child has a fear of dogs, for example, and she's 7 or 8 or 5, well, I wouldn't worry a lot, because the child will most likely outgrow and will not affect her life. But if fear persists and really affects child's behavior, then you can consult a psychologist to see if there's some form of behavioral therapy possible to reduce this impact of fear on the child. Natural environment type, it's a fear that's associated with natural environment conditions. Heights, fear of heights, very common here. It's maybe most well known. Fear of water, which person doesn't swim, for some reason doesn't swim, find any reason not to come close to water, and this person doesn't swim. So fear of darkness, adult or child refuses to fall asleep and always needs some light in a house or in apartments to help self to fall asleep, and so forth. Fear of deserts, canyons, rivers, forests, lakes, thunderstorms, earthquakes. It could be well, list can be continued. So it's natural conditions, but most common in medical settings definitely will be a fear of associated blood injection injury type fear. So here's a person simply avoids any medical situations in which or conditions in which this take place can take place. So sight of blood, just knowing that the injection is imminent, so, or just knowing that you need to go through, say, vaccination, sends persons in a state of fear, basically. Well, avoidance, of course, avoidance. Well, this is very common. It's impossible to say how many people, but at least according to some data, 10% of us do have not phobia, but maybe excessive fear of injection injury, and we try to avoid those situations as much as possible. You heard, I believe, many times these commercials in the radio about sedation dentistry. Exactly, this is for individuals who really, for the most people who will have this phobia, they can come to the dentist because of fear. But if they're sedated, they go through these procedures definitely with ease, So this is very common. You see this phenomena in clinical settings, of course. In my practice, I've known one person who really was qualified to be a medical student, to go to medical school. In excellent grades and excellent potential to become a doctor, but she just couldn't do it because of fear of even sight of blood and sight of injections. She thought she would overcome it by age 20, but she didn't, and she chose different professions. That's quite a devastating type of a problem. Treatable, of course, but it's not by simple goodwill, of course. Situational type is different from natural environment. If you feel, well, what's the difference? Here it's a situation. Airplane, basement, elevator, office cubicle, and other situations that's associated with the phobic responses. I put here like a footnote that's interesting. People with a fear of heights can spend hours and hours flying from US to Asia to Europe without any fear. But patients with fear of planes, they climb mountains. They never take a plane or with great difficulties, but at the same time they climb mountains. It's again situational type. Closed space, elevator, staircase. Those things can spark this reaction. And also other type. I don't want to scare anyone, but yeah, clowns in this category. Fear of clowns, excessive fear of clowns. Fear of costumed characters. Pirates, for example. Also in this category, fear of getting choked on popcorn, for example, or cereal. Yes, there are people who avoid buying cereal because of the irrational fear that if you try cereal, that they will choke and so hurt themselves, die. So you name it, there's many other kinds of phobias are there. And most of our fears are not phobias, please understand. So if you're afraid of something, like you don't like tickling, it's not a phobia. Simply you don't like tickling, right? You don't like certain products, it's not a phobia. You stay away from peanut butter. You stay away from ketchup. You stay away from here, there. These are not fears. They're not phobias in particular. Phobias are excessive, they are devastating, and they are maladaptive individuals. Please use those criteria. And here is a kind of brief summary for you. So these kinds of phobias exist. Treatable. People live with phobias without treatments, and they are aware of the existence and somehow manage their lives. If something really becomes interfering with your life, definitely seek professional help. Again, prime care physicians are qualified to give you professional advice about what to do next. And finally, for today, obsessive-compulsive disorder. This is a disorder which contains, to understand disorder, you have to understand two important concepts. One is obsessions. These are recurrent, persistent thoughts and preoccupations, impulses, images, so it's thoughts, ideas. And compulsions are behaviors that accompany obsessions. So it's obsessive-compulsive disorder. It's a distressful, maladaptive preoccupation with obsessions and commitment to compulsions, which are interconnected. So what is anxiety here? Anxiety embedded obsessive-compulsive disorder, because there's anxiety is underlying tool, root within us. And then people have obsessions and compulsions, somehow to address the anxiety. So it's examples, I'll give examples. Checking almost everything around you. For instance, leaving a house and checking all the electric outlets. It's not a bad idea, by the way, but if you're checking again and again and again, a person goes to bed at 11 p.m. and checks all the doors in the house. Well, it's not a bad idea, by the way, especially if you have 7 doors, 3 floors, 7 doors, basement. Yes, just you do this, fine. But what about doing it again and again and again, and waking up at 2 o'clock in the morning and checking again, and then falling asleep, and then realizing that you didn't check all the doors allegedly, and go check again. So checking, just not letting yourself go and checking everything around you. Washing, excessively washing hands. Of course, if you work in a garden, you need to wash your hands frequently, but it's not about working in the garden. It's about simple obsession with, let's say, with germs, and washing hands every 5-10 minutes. Doubting, so not making decision and always doubt, what if I do it and this will be disaster? What if? We need to doubt in many situations, but it's excessive doubting of everything. Counting and arranging things. So things must be in particular order. Everything is counted in threes or in sevens. Things supposed to be parallel, not parallel. Must be right angle and must be, well, whatever, something must be askew all the time. So it's an obsession with those things become overwhelming and destructive, of course. And worrying, of course, it's excessive worry about things, about events, about self, about essentially about everything. They can be interconnected. They are interconnected, and they are really devastating, because they affect those obsessions, compulsions affect so many aspects of your life. But we do things. We follow rituals, right? We wash our hands. We have our superstitions. We repeat things. Are we all obsessive compulsive? Not at all. Not doesn't mean this. Return to the initial slide, one of the previous lectures in which discussed mental illness, abnormality, distress, and dysfunctions. That's important points. If obsessions, compulsions become clearly abnormal, if distress is a feature of obsessive compulsive behavior and the person stopped functioning the way she or he used to, that's the beginning of a problem, and that's why we need to seek professional help. If this criteria not there, of course, we can adjust, because we do have problems, but not every obsession and compulsion is supposed to be a sign of a psychological problem. So there we go. We'll look at these anxiety problems, of course, very short lecture. In my next episode, we will study affective disorder, particularly depression and bipolar disorder and associated illnesses. It's an important subject, and I believe that will be very useful. As always, please check practice questions, check your knowledge, and so well, thank you TutorDudes again for recording this and disseminating until later. Thank you so much. It was Dr. Eric Shiraev. Thank you.